This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. During the next hour, we're going to talk about things that touch each and every one of us. Later in the show, we're going to take a look at communicating with your dentist, and I'm going to expand that to communicating with your doctor. It's really important in the days of 5 and 7 minute visits from your doc. So we'll find out more about that during the second part of our show. During the first part of our show, we're going to go to Beverly Hills, and we're going to spend some time with Dr. Laurence Orbuch. Dr. Orbuch is the director of gynecology at Laparoscopic Robotic Associates in Los Angeles, and we're going to talk about women's health. Dr. Orbuch, welcome to Late Night Health.
Thank you. Thank you for having me.
Do women of all ages need to keep up with gynecological visits?
Absolutely. I mean, it really, the necessities change over time. For younger women of reproductive age, they generally are, seeking annual visits, and then subsequently when they decide to get pregnant, et cetera, and then everything in between as far as gynecologic issues that come up. And then also in the perimenopausal and postmenopausal population, it's also important to keep up with your checkups and thin preps or pap smears and your breast exams and mammograms and all things of that sort, because there are still, it's not the health issues don't stop when you go through menopause. So it really is a lifelong process and really needs to be monitored just like all other health issues.
One of the things that I don't understand is insurance companies, health insurance companies. We're looking at it, and you're right, exactly. I haven't met a doctor yet who likes the health companies, health insurance companies. You probably have a staff. Do you take insurance in your practice?
I do not any longer, just for many of the reasons that you're thinking of, and I can enumerate.
Right.
I'll elaborate once you're done.
Got it. It just annoys me. I can't remember what age, but Anthem Blue Cross says you're over 70 or 72 or something. They don't let you take they don't pay for a mammogram anymore. I think that's criminal.
Yeah, it's the insurance companies function on in a mindset where they want to mitigate risk and keep costs down. And their goal is to spend as little per life or per client, customer, whatever they want to call them, and maximize their bottom line. So they create all sorts of guidelines and recommendations, which are ever changing. They follow certain guidelines where they tell women, you don't need to get a checkup every year. You don't need to get a pap smear, but for every 3 or 4 or 5 years, depending on if you've had normal ones in the past, et cetera, and so forth. However, what most patients don't realize is that even though they come up with these so-called guidelines, they're really not anything that they can enforce. So you can still go see your doctor every year and get the recommended testing that's the prudent thing to do. However, the insurance companies want to discourage you from utilizing your coverage.
There's no question, and again, I think it's a criminal act, and it's just not. You became a doctor not necessarily to become rich, but to help women. That's why you specialize in gynecology, right? I mean,
yeah, it's really It's really a matter of rationing healthcare, and I think in this country we haven't quite gotten to that point yet. But in many other countries where there's national healthcare, like in Canada and in England and other places, like you said, they have cutoffs. Beyond a certain age, you're not eligible for different treatments and testing because they don't think that it's cost effective.
And you're going to die. You may as well die sooner.
Right. And then, the reality of it is like, for example, in Canada, they're notorious for that. And then, for the most part, if people develop serious illnesses or pass away, because of it. Most people aren't that savvy or in touch with things to realize that, they could have prolonged their life had they received, the appropriate treatments and therapies.
What's the number one thing women need to do to maintain health?
Well, I think that the basic preventative care and self-care is really crucial. It's not, you can never say never, never say always, but many times what we see are people who are either neglect their basic annual checkups and things of that sort, or they lose their insurance coverage for a few years, so they're not willing to pay out of pocket, so they kind of put it off, and then you find these problems that developed and now have had several years to fester and progress, and that's really, it's very unfortunate. We'll be putting it mildly, and as you said before, I don't think anyone really, can't say anyone, but most of us go into medicine because for the simple reason of helping people, and that's the primary and paramount goal that we have in taking care of people.
From the Laparoscopic Robotic Association in LA, we're speaking with the director of gynecology, Dr. Laurence Orbuch. And no relationship, I've just got to say it, no relationship to the old store.
Department store, yeah.
Yeah, department store.
I wish. I probably wouldn't be here if I was. Although I think they went bankrupt, so that wouldn't have helped me much.
Or they were absorbed by somebody. Right. But that's happening with practices right and left.
Oh, absolutely.
Right? And it doesn't matter what kind of practitioner you are. Right. Big companies are saying, hey, we'll take care of all your paperwork. You only have to work 9 to 5. You don't have to take the emergency calls at 2 a.m.
It's unfortunately the trend nowadays of the corporatization of medicine, and it's either corporate type setups or academic centers want to absorb everyone, practitioners, physicians, into their system to just become another cog in the big wheel of their corporate entity, and that really is it's really not what healthcare in this country was all about, and that's really why I believe that why we have been at the cutting edge of of healthcare worldwide is because we have a system where we engender and encourage innovation and advancement of technology and treatments and therapies, to really be at the forefront of care. And
I know that we spend more money on healthcare than any other country in the world, in the Western world. Yet we're ranked, I think, like 36th in quality of care. And while we do have the innovations in the technology, there's something wrong here. It's a broken system. And we just have a moment before we go to a break, and we'll come back, and we will talk about some of the treatments that you do and find out about endometriosis. I've just been told that I have to be quiet because we are going into a break. Our guest again is Dr. Laurence Orbuch. He is director of gynecology at Laparoscopic Robotic Associates in Los Angeles. And in his pastime hobbies, he cooks. So he will join us at some point. And Mark Alyn Cooks Your Dinner, our sister program. Be sure to join us at latenighthealth.com, latenighthealth.com, for more information about all of our guests. We'll have a pretty picture of Dr. Orbuch up there and a way to get in touch with him. And you can find out more about Laparoscopic Robotic Associates. I neglected to say hello to John Van Camp, who is sitting in for the insane Daryl Wayne. We will return as Late Night Health continues. Don't go away, more coming up. Recently, I met Jacqueline from Bright here in Los Angeles. She gave me a hearing exam and then showed me how to hear again with the new Signia Pure Series hearing aids, and she can give you your life back too. I hear birds chirping, birds cooing, and even my wife. They easily connect to my smartphone. The Signia hearing aids are amazing, and with the charge and go, I don't have to fiddle with batteries and hear all day long. Not hearing is frustrating for you and your family. I know you don't have a problem, but trust me, call Bright Here now for a free hearing exam, a $125 value, yours free, just for making an appointment now. There are offices throughout the Los Angeles area. Call Bright Here now at 323-424-7100. That's 323-424-7100 for a free hearing exam. There's no obligation. Call now, 323-424-7100, or visit them on the web at brighthere.com. Late Night Health is proud of our partnership with the EBC, the Evolutionary Business Council. Check them out at ebcouncil.com.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
Role models. They can make all the difference. In our world today, they have never been more important. One of the nation's most successful mentoring organizations is Jewish Big Brothers Big Sisters of Los Angeles. Their mission is to assist youth in achieving their full potential through innovative and impactful programs. And no nonprofit agency does it better. Jewish Big Brothers Big Sisters of LA serves Jewish children, boys and girls in our local community with a mentoring program that's been going strong since 1915. That's only the beginning. This nationally known agency owns and operates Camp Bob Waldorf. Its summer camping and weekend retreat programs enrich the lives of youth throughout Greater Los Angeles. Then there's a college support program, and last but not least, work that helps kids all over the world through the Teen Talk app. Want to learn more? Go to jbbbsla.org. Donate. Get involved. There's no better way to make a difference.
The latest from the greatest, the best in new music by classic rockers, with your host, the insane Daryl Wayne.
This is Alice Cooper, and if Daryl Wayne is insane, what does that make me? Criminally insane. Stick around to find out.
Many of the artist interviews for the latest from the greatest have been captured on audio book. There is a Volume 1 and Volume 2. Great information and conversations with people in the industry and people surrounded by the industry, and of course the rock stars themselves.
I'm the Reverend Al Green, and you're listening to the insane Daryl Wayne. And I said Wayne Insane.
You can find it on Amazon or Blackstone Audio. Search for the latest from the greatest from Daryl Wayne, Darrell Wayne.
Hello, this is Weird Al Yankovic, and you're listening to the insane Daryl Wayne, aren't you?
Sometimes it's not what you say, it's how you say it. Words are a critical aspect of success. How you get your point across is a crucial part of what makes anything sell. So do it right and hire a writer. Whether it's articles, blog posts, technical writings, website content, product descriptions, or ghostwriting anything from a novel to a nonfiction book about your navel, contact Servet Hassan. If you want it to sell, write it right. Email Servet at servet@servethassan.com.
Late Night Health continues. I'm Mark Alyn, along with John Van Camp, sitting in for the insane Daryl Wayne. We're talking about women's health, and we've had a very good discussion with Dr. Laurence Orbuch. He is the director of gynecology at Laparoscopic Robotic Associates in LA, and he uses something called the Da Vinci robot. It's interesting because if you edit video, one of the editing programs that are out there right now is called Da Vinci editing and color correction. So Leonardo has resurrected in numerous fields. Let's talk about the fact that, 20 years ago, having a hysterectomy or other female related surgeries You had bed rest and lots of issues with the laparoscopic and the robotic surgery techniques. You don't even have to see the patient, do you? You can just sit there and work on a computer.
Yeah. So the old school surgeries were called laparotomies, where you had big open incisions. So you'd have an incision, like 8 or 10 inches long, and like you said, most people were in the hospital for several days or longer, and the recovery was, a few months. Laparoscopic surgery is surgery. It's in the realm of what's called minimally invasive surgery, and robotic surgery is the most advanced form of laparoscopic surgery. So it's also laparoscopic. The incisions are small; they're 8 or 10 millimeters. You use fiber optic cameras and very miniaturized instrumentation. The difference between what we call straight stick laparoscopy and robotics is that with laparoscopy, you're actually at the bedside, putting the instruments in through these tubes called trocars, and then doing the surgery, manually, controlling the instruments. The robotic platform, basically, you use similar kind of tubes to put into the patient, but then the arms are connected to these robotic arms, which you then control from a surgeon's console with both hand and foot pedal controls, and it has multiple advantages over standard laparoscopy, because it gives you a 3D high definition image. So you literally, you put your head into the viewer and you feel like your head is inside the patient. And then the instruments are very maneuverable. They're called wristed instruments. So the instrument ends can move like your hands, as opposed to laparoscopic surgery, which is, we call it straight stick because it's a straight, shaft with an instrument at the end of it that you can, if it's a scissor, you can open and close the scissors, or a grasper or whatever you're using, but you don't have that ability to get in and around things or over them or under them. So it really gives you superior maneuverability, better visualization, and the ability to do, and literally getting within, the camera gets within about 8 millimeters of what you're working on. So it's like having it this close. So,
wow. It's like having opposing thumbs.
Yeah. It's just, and it allows you to control all the instruments. So with standard laparoscopic surgery, you need an experienced assistant on the other side of the table, because you can't control all the instruments from one side of the table. Whereas with the robotics, you control all the instruments, and you can hold things and then shift and then use 2 other instruments while you're holding up something, and it really allows for complete control of the operating surgeon, and there are other benefits. There's generally less postoperative pain, quicker recovery, and the ability to do more advanced and intricate surgery because of all these advantages that it offers.
I remember doing, 20, maybe 25 years ago or more, interviews about laparoscopic where doctors would go in through the belly button.
That's where you generally put the camera in. You kind of hide it inside the belly, an incision inside the belly button, and then the other instruments go laterally in the abdominal wall, depending on where you need to access. And
it doesn't matter if it's a innie or an outie?
No. I mean, it's easier to hide it with an innie.
Got it.
You got to find a little crease to make that incision.
Got it.
So cosmetically, people love it because it really, they're small incisions and they heal very quickly, and usually within a few months, most people are hard pressed to even find the scar from where they had the surgery. Wow.
Endometriosis is somewhat serious, is it not? And it's a fairly common. Is it a disease or is it?
There's condition, disease. I mean, it affects roughly 10% of women. So 1 in 10 women, have it. That translates to nearly 200 million women worldwide. And it's a condition where, the endometrium, which is the lining inside the uterus, you find implants of cells that resemble that lining outside of the uterus. So unlike the endometrium, which, if you have your period, you shed and the tissue comes out, if you have these types of cells elsewhere, let's say in the abdominal cavity, on your ovary, on your bowel, on your bladder, it could be anywhere. You have the same bleeding and inflammation that happens in the lining of the uterus happens in these implants, and it triggers inflammation, pain, and all sorts of associated symptoms. So women have, it falls into the realm of, pelvic pain, which is a general kind of term, and it can start. It can start as early as childhood or puberty, or it could manifest later on in life. It varies in its presentation, and it can cause not only pain, but it can cause fertility issues. In roughly, depending on what study you look at, a third to a half of women will have a hard time conceiving, or they'll have recurrent miscarriages. So it really, it can affect any system in your body. The most common ones are usually gastrointestinal systems. So women have a lot of GI symptoms, bloating, and things, and motility issues, intolerance to foods, bladder issues. I mean, it can pretty much do anything. And that's what generally throws people off, because there's an over 10-year delay to diagnosis in this country. So we're not talking about in the third world. So, and that's because a lot of times people will present with these varying symptoms that kind of throw practitioners off the trail, and they start treating symptoms rather than looking for the global cause of the problem.
The holistic approach to Dr. Orbuch.
Right. Yeah. So, you have to look at the big picture. And, my philosophy of practicing medicine is you can never have tunnel vision. You don't want to be looking focused on one area when it seems to be a more global issue. And because of how endometriosis, the pathophysiology of this condition is, it sometimes will manifest more with associated conditions or different pain generators that pop up before, the common findings. And the other problem is also there's a lack of awareness and, unfortunately, a lack of education among physicians and nurses and all healthcare providers about endometriosis, what it is, what causes it, what are the symptoms that can manifest, and proper treatment and diagnosis.
Well, we're going to have you back so we can talk about fibroids, because fibroids is a major issue with women, especially over a certain age, and they can be extraordinarily painful. And we also have to talk about hysterectomies, because at one point, that was one of the biggest things that women underwent, hysterectomies. I mean, and it was almost rampant. And we can talk about that. Will you come back?
Absolutely.
All right, good. And he'll cook with us too. I can't wait. He gets to boss me around on that show. Anyway, our guest, Dr. Laurence Orbuch, Director of Gynecology at Laparoscopic Robotic Associates in Los Angeles. He's based in Beverly Hills. We appreciate his time. We'll let you have all the information you want about Dr. Orbuch by going to latenighthealth.com. We'll have a link to his website there. And just visit us again at latenighthealth.com. Doctor, again, thank you very much. John, thank you very much. We'll be back in a couple of moments. We're going to talk about communicating with your doc, whether it's a dentist or a doctor, maybe even an acupuncturist. We'll find out more as Late Night Health continues.